And maybe it's
Yeah.
interesting to go to one of the cases, because there was one case report of the gastroparesis healing.
Yeah.
Someone 16 years of chronic syndrome resolved after proximal intercessory prayer. And it was with your colleagues Clarissa Romesa and David Saritskia
Yeah.
and Joshua Brown. Yeah, that's it.
Yeah. Yeah.
So that's
Yeah.
interesting.
This was, I think, the first one of the early cases we looked at. And so this was a case of a male infant who was born and basically couldn't keep food down. You know, he was um, he would vomit, and it got pretty bad. So after a lot of tests, he was diagnosed with gastroparesis. And gastroparesis just means the stomach is paralyzed. So normally
Okay.
you eat, you swallow, the food goes into the stomach, and the stomach contracts, and that pushes the food down into the rest of, the small
Hmm.
intestine, and his stomach was paralyzed. And this was verified with what's called manometry, which is where you put a little balloon-like thing into the stomach and measure
Hmm.
the contractions. And
Yeah.
that result showed that there were no contractions. And so the
Yeah.
food, if he swallowed any, would just sit in his stomach and rot until he vomited it back up. And
Yeah.
and so he had surgeries, multiple surgeries, to put in tubes directly through the abdominal wall. One was a tube to inject like liquid nutrients directly into his small intestine, into the
Right. Yeah.
jejunum. And another tube was put into his stomach so that he could remove anything that he had accidentally swallowed. And so this was how he lived. He basically just didn't eat for the first 16 years of his life. All the nutrition was injected directly into his small intestine.
Yeah, you can't
And
make this up,
now,
Josh. If you have a muscle, if you have a muscle in your arm, you can make it up. Don't use it, but you
yeah,
can't with a muscle in the stomach.
right. And so I mean, the diagnosis of gastroparesis was made. It was ongoing, and he was so this went on for 16 years. He was unable to eat, and he would have to, remove the food from his stomach and inject it into his small intestine. And so we had so anyway, he was 16 years old, and he ended up going to a prayer meeting, and there was a guy who was speaking at that meeting, who himself had been crushed by a semi truck, and the semi truck had crushed this guy's the speaker's intestines to the point where his intestines, most of them had to be surgically removed because they were destroyed. And so he had such a small length of small intestine left that he couldn't absorb nutrients. And he had been slowly starving to death despite eating normally because he just
Mm.
couldn't absorb the nutrients. And so this guy had previously gone to another prayer meeting, been prayed for. He said he felt something like a hose uncoiling inside his stomach while he was inside his abdomen while he was being prayed for. And after that, he just started gaining weight. He was able to absorb nutrients, and we looked into his
Wow.
case, and we couldn't. The one of the doctors who had operated on him, because he had had multiple surgeries, described that the uh, he noted that the intestines immediately after the accident were very short, like barely I think a meter or so. But that on a subsequent surgery, the surgeon noticed that they seem much longer now, and small
Yeah.
intestines don't just grow. Like,
No,
that doesn't
no.
happen. And yet and the doctor said, well, I didn't want to write that down in the official medical records because people think I'd lost my marbles. So
But
he
it would be
didn't.
the
So
truth.
we had no documentation, and it's not possible as of the time we looked at it
Mm.
to do non-invasive imaging to measure the intestines. There are methods that are being developed, but they're still experimental at this point and
Mm.
not available. So anyway, we looked into this case too, the case of the speaker, to see if we could, document that as
Hmm.
essentially a miracle. And because we couldn't get that clear documentation that the intestines had grown, we weren't able to. But anyway, so this boy who's now 16 goes to the meeting. This speaker is describing how he was, starving to death with with his short gut syndrome, and how he was miraculously healed apparently through this prayer. Well, this 16-year-old boy went up and started talking to the speaker afterwards, and they were comparing scars and experiences, and the speaker prayed for the boy, and as he was praying, the tubes in the boy's stomach started to vibrate, and they're moving around, like, and anyway, that night the boy went out and ate a meal for
So
the first
he
time in his life,
experienced healing. I mean,
and
he
it
shouldn't
went
have
through
done it.
him normally, and
Yeah.
his stomach was no longer paralyzed. And so after 16 years, he
Wow.
was suddenly fine, and he was fine. He was able to eat normally from that day. He had all the tubes removed about 3 months later, and he never needed any of it again. So, we had multiple academic specialists in gastroenterology look at these case records. And, there are some cases of gastroparesis that are caused by a virus, and those can resolve
Mhm.
in 1 to 2 years. But there was no precedent and no explanation for why someone would have a paralyzed stomach for 16 years and then suddenly be, instantly and permanently healed of that.
It's not known in literature.
There, apart from the report that we published on this, there was
Mhm.
there's no precedent to my
Wow.
knowledge anyway.
Well, then people say this. There are a few possibilities. This is a placebo, and that means, let's say, we already talked about it a little bit, but it's
Yeah.
something which shouldn't work, but it's with suggestion or,
Yeah. Well, I think the first thing to say is that, like, placebos get kind of a bad rap, but they are real,
and they work.
and people can experience pain relief
Yeah.
from placebos. People can experience benefits from them,
Yeah.
and so I think, first of all, I wouldn't, I mean, placebos are real.
Yeah.
So I think the question is not, the question then is, could a placebo effect account for a resolution of gastroparesis?
Mhm.
And here again, the specialists that we talked to didn't think that was likely. I mean, if the stomach muscles are paralyzed, it's unclear how some suggestion or a placebo
Mhm.
effect is going to
Yeah.
unparalyze the stomach muscles. I mean,
Yeah.
it's like, we like to see, we love to see people who are paralyzed, unable to walk, get out of wheelchairs, but we haven't seen any evidence that a placebo effect by itself can, help
Mhm.
someone with damaged spinal cord,
No.
who's paralyzed,
No.
suddenly be able to walk. So there's
So
some things that placebo effects can account for sure.
yeah.
But there's some things where that doesn't seem very plausible.
So, and you already said that the natural course of this disease is not described, that it's getting healed, and no, the diagnosis was not wrong. It was very clear, and it was also
Yeah.
not a psychosomatic or a functional disease. That's also what
Yeah.
I read, because that's those are the things skeptics usually name, and
Yeah.
and these are the things you have to get rid of
Yeah.
and argue. No, yeah.
Yeah, well, and I think so. Functional disorders, the variously called conversion disorders,
Mhm.
functional neurological disorders, those are real, and you have to
Yes.
consider those if you're looking at a particular case. But I think here again, the diagnosis of a conversion disorder or functional neurological disorder
Mhm.
is appropriate when there's not evidence, there's not organic evidence of disease. There's not evidence that there's physically something wrong. And so, there are cases of eyesight recovery that do seem to be functional.
Mhm.
There are cases in the literature, for example, of people who are, sincerely unable to see, but there's a psychosomatic cause, and when you address the underlying, psychological disturbances and trauma,
Yeah.
often their eyesight recovers. But those cases will will show that there's no organic cause of the blindness. There's nothing wrong with their eyes. There's nothing wrong with their visual system in their brain. There's nothing wrong. It's just that they can't see, and they sincerely can't see. And so the diagnosis is made when there's no evidence of a physical disease process. But in this case, with the gastroparesis, there was clear evidence that there was a paralysis of the stomach, and that was the source of the vomiting and the inability to keep food down.
Mm-hmm.
And the stomach is controlled by its own little nervous system, right, which has some links to the brain, but it operates separately from the brain. I mean, you can be asleep and your stomach will still digest and move food through. And
Oh,
so this is not something, psychosomatic functional disorder. His stomach was actually paralyzed.